Young children hospitalized with COVID. It's our top story tonight as we hear about more young children in our hospitals. The county judge revealing today that University Hospital admitted an 11-month-old COVID patient.
And a 4-year-old is on a ventilator at the Children's Hospital. The Night Team's John Paul Barajas spoke with the chief medical officer of Christus Health. He explains what parents need to know about how this new variant is impacting children more than the previous variants.
COVID case counts are soaring, and this time kids aren't being spared.
It's alarming. It's scary. At first, I didn't want to get the COVID either. I was dead set against getting that vaccine. And I said, you know what? You got to weigh out the risk. At least protect yourself and protect others. Because not just you, that they're concerned with, it's everybody else.
Lena Smith is the mother of a 1-year-old. She says when her son is eligible, she'll get him vaccinated. Until that's possible, Dr. Charles Hankins, chief medical officer of Christus Health, explains the best way to protect kids under 12 is to get those who can vaccinated.
We have just as many patients admitted between the ages of 20 and 40 as we do over 60.
Currently, San Antonio has 63% of eligible people fully vaccinated. Dr. Hankins wants that number to go up to keep children hospitalizations down. He adds in previous surges, at most 2 to 3% of child hospitalizations were COVID-related, and those were usually teens with pre-existing conditions. Now it's at 10%, with half of them in the ICU and the patients' ages even younger.
We had a few newborns that were impacted from the maternal disease that was transferred to them. But our youngest admitted that's on a ventilator in the ICU is 4 years of age.
He explains at this time they aren't exactly sure what the long-term effects for these babies and toddlers might look like. And unlike in previous cases, Delta is hospitalizing kids who don't have underlying health conditions.
Seems to be attacking these children differently. So more aggressive. So not only spreads more easily, but for the population of children, it also seems to be more aggressive.
And with the school year just days away for some, Dr. Hankins fears that child hospitalizations will rise, but he doesn't think kids should stop going to in-person classes. He thinks that they should do that, but they should do that masked up and socially distanced. John Paul Barajas, KSAT 12 News.
Thank you, John Paul. Now, concerns are rising in San Antonio. Take a look at this rapid testing site near Fredericksburg Road and Loop 410, bumper to bumper. Cars lining up to try and find out if they have the COVID virus. The people inside those cars are. One woman says she wanted to get tested to make sure her allergies weren't COVID instead.
Been sick and a little under the weather for the past week and a half, so I just wanted to make sure before I head back to the office from working from home.
A reminder, those who are vaccinated can still spread the virus. Health professionals still recommend wearing a mask to avoid unknowingly spreading COVID-19. The vaccine can help you avoid the hospital and serious illness. Dr. Larry Schlesinger is the president and CEO of the Texas Biomedical Research Institute here in San Antonio. They worked with other scientists to come up with a vaccine. He says scientists have been studying mRNA technology for years and have also developed research on the series of coronaviruses. This is what gave scientists an edge when developing the vaccines we use today.
I want to state this vaccine was not rushed out the door. This vaccine represents the extraordinary efforts of scientists working together with healthcare professionals around the world to respond to a crisis and urgency with SARS-CoV-2.
Dr. Schlesinger joined us for our KSAT Q&A at 6 o'clock tonight. You can catch the rest of our conversation with him online if you'd like at ksat.com. A reminder, the state has a mobile vaccine program. All you need is a group of 5 or more to request that team come to you. That group can be made up of co-workers at a business, members of the same family, or a gathering of friends. Doesn't matter. If you would like to request a visit, call the Texas Mobile Vaccine Call Center. That number on your screen, it is 844-90-TEXAS.